Hello, good morning from Sydney, Australia. So we didn't get any questions this month, but there was a couple of things I wanted to discuss. So Freya says good morning. Say hi. So because of Freya's dementia, she's often up in the middle of the night. So she has had so many treats. She's been a very spoilt pup, haven't you? Yes, you have. Um, So hopefully she'll let us have a little chat. So the first thing I wanted to chat about was people that have, I think, in my 2 cents, is too much money and not enough sense. So when I took Freya to get her liver CT scan, okay, you want to move that? You want to lie down next to me, sweetheart? Yeah, I don't know where you're going. Um, I overheard, like, it was like this miniature poodle, and it was booked in for a TPLO, and it literally ran with the nurse to go, you know, to their pre-op. And I'm like, that just does not make sense to me. Like, why wouldn't you choose other conservative management when the function is so good? Like, the dog can run. Like, I remember the only reason I got Kibra and Freya their TPLO is because they couldn't walk. They couldn't even put that leg down because the cruciate and the meniscus was so damaged that yeah, they just couldn't weight bear on it at all. So, and I'm like, but there's this little dog that is literally running to, to go get its operation, and it just doesn't make any sense. And I think it really comes down to education and um, getting confidence for pet parents to try something, to say, okay, you know what, the vet recommends surgery, and potentially surgery is definitely necessary and unavoidable sometimes, absolutely. Um, but I mean, why not try something a little less invasive first? Oh, yes, my darling Belle. We've even been for a walk this morning. It's every time I speak and I have a laptop in front of me. So I guess I just want to try and encourage you, and even to share it with other pet parents, that you know that it's okay. Um, if if the function is still good, and and the operation is probably unavoidable, but you can delay it. It's like, well, I don't need to do it now. And of course it depends on the age of the dog. Like, if if I had a 8-year-old dog, I probably wouldn't postpone it, because as they get older, potentially the risks and their ability to process the like the anesthetic, that kind of decreases. And so I would, yes, definitely. Oh, you want to say hello? I know you want to say hello. I know you do. She's like, well, you're talking to me, Mama, but you're looking at the screen. Why? Why? Let me just say hi. Hi. Yeah, that's you. That's you, my princess. Um, So yeah, and it's also trying to break down the barriers about hydrotherapy. I've gone on this before, and saying that it's okay. The first kind of textbook thing is surgery, and then it's hydrotherapy. But it's okay to try something else, which may actually be more beneficial for your dog. Um, Oh, I know you're so talkative today, aren't you, baby girl? So please share that with your friends, and say that it's okay with the right guidance. You can, there's lots of things you can try before having to go down that path. Number two, I'm always so proud. A lady had a dog in the street. I can't remember what breed it was. I think it was like a cavoodle type. And we were talking with some other people. So there was like a group. I know. Do you remember it? It was last week. Do you remember it? Yeah, last week. Hang on, let me get some treats and I'll see if I can just bribe her. Oops. Ugh, okay, we've got the treats. I got a bigger treat bag this week because um the other one was just too small. So this is big. It's got like a magnetic clip and it just means it keeps the treats in. Um there's a little pocket so you can put keys or I don't think a phone would fit in there. And then in that space there was some poo bags, which I just took out because I have another, like this is mainly used indoors. I don't use these on walks, but we just fill it up with treats. So there was a group of five of us, and we were talking about this other dog. I said, "Oh, how old is he?" And she's like, "Oh, he's 3." Okay. And she's like, "Oh, how old is your dog?" I said, "Oh, she'll be 13 next month." And she's like, "Oh my goodness, I can't believe it. I thought she was like, 4 or 5." And I'm always so proud when she says that because I've worked really, really hard at trying to keep Freya being able to move so well and look as though she's not a senior dog that she is. And I guess I want to differentiate this to people who say that um, they're like, "Oh, my dog still runs around like a puppy." To me, that's a little bit ignorant because the truth is that they're very not a puppy. Their body has changed. Like, I know it doesn't look like it from the outside, other than like the gray hair, but really, it's their insides have changed. There's a lot of the nerves slow down, the muscles get smaller. um they might have heart problems. Like it's a very different dog, and I know people have difficulty detaching themselves from the reality that, okay, my dog is older and it's closer to saying goodbye, and that's a scary thing, and I completely understand that. But at the same time, I think it's important that we not be so ignorant to think that, oh, my dog runs around like a puppy. It's like you've got to treat it like a senior dog. Um, Even if it moves well, which is great if it does, but is your ignorance hiding the fact that that dog is in pain and just running around like a puppy, but uncomfortably so? So that's just something that really upsets me because I just they kind of just brush it off and say, "Oh yeah, he still moves like a puppy." I'm like, "Really?" Like, but do you like, oh, did that go down the wrong way? Sorry, sweetheart. Um, but yeah, just trying to understand the truth about your dog that is changing. And oh, we dropped a tree. There you go. Yeah, there you go. Just understanding that, yeah, your dog is changing, and we definitely, we almost lost the laptop, and this is a new laptop. I just bought it last night because I dropped my other laptop, and then a third of the screen, the top right hand corner, was missing. And you wouldn't know how important that top right hand corner is until you don't have it. Yeah, just wait, please, my darling girl. And yeah, so also, I just think there's so much education that's needed in the space to, how we view our dogs, how to just oh yeah, they'll be fine. And they are resilient creatures, but the thing is, they're also very good at hiding pain. And that's what I don't want. So a lot of education is around that. And then the other education is that yeah, your dog is different. Aging affects the insides. It doesn't only affect the outsides. And so, yeah, it's a tough topic. But I always do get so happy when I hear that people think that she's a lot younger um, because I really do think that everything that I'm doing, which is based upon what I was trained in my physio degree, and science, is to try and keep her as mobile and happy as possible. And I mean, she might just even have very good genes. I mean, genetically speaking, we don't know. She was a rescue dog, so we don't know her background. But but yeah, just it makes you feel good knowing that you're trying so hard and you can see the rewards of all your hard work when they're moving so well, and then other people, compliment you too. So that's always a lovely feeling. Get your nose out of that. Get your nose out of there. Um and yeah, that's a good girl. The other thing I wanted to have a quick chat about, I'm gonna close that. Yeah, just wait. She's so cheeky. Is that I've really struggled trying to find the technology that allows us as pet parents, and caregivers to our dogs, the right technological space to for me to teach, and to encourage, um, all and pass on all these physio principles that I have. So at the moment we're in Click, but I am considering going back to Kajabi because Click wasn't the platform that I thought it would be. And unfortunately, it's just trial and error sometimes, and I know it's a bit of a bother. But I'll try and make the transition for you guys as easy as possible. And remember that if you are signed up to the dog rehab app, you do get, this community free. And then when I move it, it'll still it's still the community aspect because my app doesn't allow that community aspect, unfortunately. Um, and I just want to keep encouraging people to ask questions. There's no shame. I don't you know, I want to try and decrease your stress, encourage you that you're doing all the things you can, and just help your dog live longer and better. All right. Well, Freya with a very full belly is going to say bye. Say bye. Bye. All right. I'll be in touch and I'll speak to you soon. Bye.